Craig Hospital's Research Department, established in 1974, conducts high-quality research to promote optimal health, independence, and life quality for people affected by spinal cord and brain injury. With a $6 million annual budget, the department relies on funding from federal and state agencies and generous donors. At Craig, we are translating clinical questions from bedside observations, therapy gyms, and the community into research that answers the questions our patients, families, and staff are asking. Craig has many translational research lines currently in progress. Several studies are looking at wheelchair seating, positioning, and mobility. Many Craig patients use a wheelchair following discharge, and a recently completed pilot study shows that solid backrest, instead of padded, improve postural alignment, function, and mobility. A current study is evaluating the impact of axle position and frame type on efficiency with hemi-propulsion. Data gathered in this study could help Craig clinicians advocate to insurance companies to ensure that patients receive the best type of chair for their needs. Craig conducted a pilot study using transcutaneous spinal cord stimulation in 7 individuals with tetraplegia. This process involves placing electrodes on the skin directly over the spinal cord. The frequency pushes the stimulation into the cord and essentially increases excitability of the nervous system. We found that the majority of the study subjects were able to increase both upper and lower extremity function. Moving that line of research forward, we are currently involved in a multi-center study focused on improving upper extremity function to assist with FDA clearance for the device. Currently underway, a pilot study is comparing treadmill training paired with virtual reality to locomotive training alone in comparison to standard care physical therapy objectives. Using a donor-funded C-mill treadmill, we can project objects onto the treadmill and on the screen in front of the patient. The goal is to determine if engaging both cognitive and motor components of the nervous system can help improve recovery for patients with brain injury. The Wide Pulse Functional Electrical Stimulation pilot study looked at the benefit of providing outpatients with electrical stimulation in addition to exercise training. Initial data from this pilot study found that patients who received the intervention saw significant improvements in upper extremity strength, function, and trunk stability. This promising data will lead to a larger study looking at the efficacy of the intervention as part of the Spinal Cord Injury Model Systems Grant. We know that research drives practice, and practice drives research at Craig. Through our translational research program, our clinicians can take what they learn and either expand their inquiry or apply that learning immediately to enhance the care we provide to patients. And none of this work would be possible without the support of generous donors to the Craig Foundation.